time when the NHS is under pressure as never before, facing reorganisation, a financial squeeze and pay constraints. So they were ready to give the Health Secretary a tough time. But if he felt trepidation, Andrew Lansley didn't show it. He told nurses he was there to listen, but when he asserted that the number of clinical staff in the NHS had gone up, one of them called him a liar.
Clinical staffing levels overall have gone up. The issue of the balance of staffing... Well, I'm sorry, but they have by nearly 4,000 additional professionally qualified clinical staff. The number of nurses, the number of qualified nurses has gone down. The number of health... Yes, I know, by nearly 3,000 in 2 years.
As the heckles continued, the chair of Congress cut across what the Health Secretary was trying to say.
I hope you are hearing that my colleagues out there are really concerned about people actually listening to them and then taking action on what they are hearing.
Yeah, I agree, absolutely.
He took questions about the reorganisation of the English NHS, about pay and pensions, and about staffing levels and the care of patients.
How safe is the NHS in your hands?
It could have been worse. A previous Labour Health Secretary was jeered when she spoke to the RCN, but Mr Lansley was warned not to be complacent.
Because you've had a highly professional and dignified encounter with the Royal College of Nursing, don't take that as some kind of indication that things are fine. There's a great deal of unhappiness.
So how have you been today?
Fine, thank you, yes.
Up the road at the local hospital, they're dealing with those pressures on a day-to-day basis. Unlike other departments, the health budget in England hasn't had a cut. But even a financial freeze is difficult when patients are getting older and sicker. And while there's a dispute over the number of jobs going, the government acknowledges there are now fewer nurses. When we spoke to a group of nurses, they said they were finding it harder and harder to deliver good care.
It's frustrating. It's bureaucracy, a lot of it as well, and it is very frustrating because you're trying to provide the quality care that you want to do.
Meeting all the targets and still being able to manage and give good quality care.
With the English NHS just beginning its biggest ever reorganisation, the government needs the backing of nurses. The mood music here suggests they still have some work to do. Jane Hughes, BBC News at the RCN Congress in Harrogate.
Becoming increasingly fed up and disaffected and at the end of their tether. If these reforms fail, it will be because of a government that didn't listen, not the nursing staff who tried to make them work.
If we want to counter this in the workplace, it's up to you to go and do that. You do it through your steward, you do it through your branch, you do it through your boards, you do it through your regional officers. But don't sit here and say, wait for someone else to do it. It doesn't call for anyone to do anything here. The action and the power is in what you say on a local level to your foundation boards and the governors and the press. Do something about it. Don't let this happen again. We sat on our hands for far too long about patient care. We let standards slip. Also, we need to break the last taboo of British healthcare, mental health. This government doesn't own the National Health Service. It's the British people who own the National Health Service.
dialogue that to affect the care I deliver? Absolutely not.